Aloha and welcome back to Hi Now Daily. Now, November is National Alzheimer's Awareness Month and an opportunity to educate the community on the disease. I'm here with Dr. Corey Liao and Dr. Keawe Aimoku Kaholokula. Now, today, we're discussing ways we can close that gap when it comes to care for the Native Hawaiians and the Pacific Islanders because we're at greater risk. Is that right?
Absolutely, yes. Alzheimer's is a common condition, especially it affects Native Hawaiian and Pacific Islanders, especially those with heart disease. There's a higher risk for developing Alzheimer's dementia. So we're so fortunate to thank you for having us on.
Absolutely, it's a big deal. We got to talk about this, especially if we are at higher risk. And why is that?
Well, several factors, as you mentioned, cardiovascular disease, but a lot of the risk factors for cardiovascular disease, high blood pressure, high cholesterol, smoking, obesity, are all contributors to the risk for Alzheimer's. So, and that's high in our communities, right? We have some of the highest prevalence of these medical conditions.
Yeah, one of the things that we really realized is that we just published the findings that we looked at the Hawaii Medicare data for the last 9 years. We found a strong heart-brain connection. The Hawaiians that have a strong heart disease tends to develop Alzheimer's dementia. So remember to keep the heart healthy because it's good for the brain as well.
Absolutely. And then I wanted to touch upon not only the Native Hawaiians and the Pacific Islanders, but in addition to that, those that are coming from lower income families and those who are at greater need, we're seeing a lot of disparities there, right?
Exactly. Higher risk in lower socioeconomic, lower income, even lower levels of education. And that's probably because it's associated with some of the other risk factors we mentioned earlier, right? Because just less resources and opportunities for choosing healthier lifestyles. But it's totally addressable. We can actually go upstream and prevent these things by getting a handle on these, they call vascular risk factors, the hypertension, the high cholesterol. And one of the reasons we get it earlier, the early onset of Alzheimer's in our communities, is because we get disease 10 years earlier than other groups.
Wow.
So really starting younger. So we're seeing people in their 45, 50s who are already developing subjective cognitive impairment or mild. So we're trying to develop interventions to actually go upstream and address that.
I'm glad we're talking about this today, actually, because I was thinking, we live in Hawaii. We have a great opportunity to get outside and work out. I feel like we're very healthy. But to hear that, we're getting, Alzheimer's 10 years earlier than other people, that ain't right. So there's some ways that we can, incorporate our culture into being proactive, right?
Yeah. We actually did a study the last 10 years looking at leveraging hula as the foundation for an intervention as a physical activity, but also a cultural activity to improve hypertension, high blood pressure, that are managing that and reducing their risk. So we found that actually Native Hawaiians who undergo our hula intervention actually improve the management of their hypertension, but also improve their 10-year risk for heart disease. And now we're taking that and turning that into interventions to address Alzheimer's and looking at the risk factors I mentioned earlier more broadly and seeing whether or not we can actually either delay or prevent people from going on and developing Alzheimer's.
Very cool. I love that. Incorporate the hula because that's going to help us out.
Yeah, our kupuna were smart.
That's right. Yeah, so that's why we got to learn from them. Keep up our traditions, keep pushing through, right? And then Dr. Liao, I wanted to talk to you about, Pacific Neuroscience. You guys are always trying to get out into the community. Outreach is very big for you folks. So tell me a little bit about that.
Yeah, thank you. One of the challenges besides trying to get ahead, providing access to like Native Hawaiians, providing, one of the challenges is really early detection. I mean, it's unlike a heart disease, you get a chest pain or something. Alzheimer's is not easy because you kind of have to have memory loss. So one of the challenges that like the doctor said, you could develop this 10 to 20 years before the symptoms. One of the things that we try to do is look at brain activities. One of the research is whether brain activity is kind of like an EKG of the brain. When we look at the frequency, when we look at waves, can it be an early detection? Would it be nice if someday we don't have to wait till patients is forgetful to really say, hey, we can help you, we can intervene, we can bring some intervention, but we can actually catch them early and do some intervention early, especially in the Native Hawaiian and Pacific Islander population.
Absolutely. Stay ahead of the game, man. Be in tune with your body and go in for those checkups, right? And you're also, bridging this gap by providing the information and resources to the community, and you guys partner with a lot of other people, right?
Yeah, we partner with a bunch of Native Hawaiian Pacific Island communities. We're working with Hawaiian homestead communities across different islands, Native Hawaiian healthcare systems, some of our community health centers that predominantly serve Pacific Islander communities that are from Micronesia region. So we're really trying to get communities involved and really trying to get them as part of the solution. So they co-lead, they co-produce the work with us, because it's really about sustainability and doing health promotion strategies that make sense for our communities.
Absolutely. And where can we get more information?
We can go to hawaiineuroscience.com and get information on either community events related to dementia or clinical trials, the latest treatment, or research on brain activities, EEG, on how it can be an early tool to detect. Early detection is really key, and don't forget the heart-brain connection.
Love that. Thank you two so much for joining me today, for bringing this plethora of information for the community. Of course, it is November, Alzheimer's Awareness Month, so make sure you are, staying in check with your body, mind, soul, everything. You guys, thank you so much. All right, you're watching High Now Daily. We will be right back. Right on, man. That's awesome. Thank you.
That went by fast.
Good to see you again, Dr.
Yeah,
Go.
thank you.
Oh,